Why does Blackpool have such a low life expectancy? We can use the index of multiple deprivation to explain this. Oh, that's a mouthful. What is the index of multiple deprivation? It's basically a gauge which determines which areas are deprived and which areas are not deprived. It uses factors like housing, income, crime, employment, education, and living environment to dictate this. Okay, let me give you an example. Let's say you have a poor living environment. There's a cliche quote, but just because it's cliche doesn't mean it's not true. You're the average of the 5 people you spend the most time with. If the people you spend time with are alcoholics, drug addicts, then there's a high probability that you may emulate some of those negative traits. Peers that are not positive influences have a negative role in terms of influencing your life choices. Some of those life choices may dictate poor health outcomes and a poor lifestyle, which may result in a vast array of different issues like coronary heart disease, diabetes, and obesity. Moving on to education, if people aren't educated behind the science about why smoking is bad, the fact it damages the alveoli, it reduces the amount of elastin in your lungs, so it means that they're not as elastic. If they don't understand how a diet concentrated with saturated fat can result in obesity, they might not understand how to shape their life. Furthermore, in terms of living environment, Blackpool has some of the most highest levels of pollution out of any area because it's a very industrial area. This may increase the chance of respiratory disease, right? Now, moving on, the NHS has enforced an initiative called Core 20+5. So as per the Index of Multiple Deprivation, they determine the 20% most deprived areas and they focus on 5 aspects of health for the adults: mental health, maternal health, cancer, hypertension, and respiratory diseases. Hence, healthcare inequalities are the avoidable disparities and differences in the health outcomes of different people. If you talk about Core 20+5 and the Index of Multiple Deprivation to formulate your answer, I'm sure you will smash this question. Healthcare inequalities are also often referred to as a postcode lottery. As children growing up, we don't have power regarding where we live where our parents live. And whether that area is in a highly deprived area or a less deprived area is a complete lottery.